In a bid to bring about a viable option to address the burden of health financing militating against effective healthcare delivery in Anambra State, Governor Willie instituted the Anambra Health Insurance Agency (ASHA). The move was born out of the love and concern Governor Obiano has towards the health of the people of the state, thus making him the first governor of the state to initiate the scheme. The administration of Governor Willie Obiano had introduced some health reforms which saw the primary health care arrangement in the state strengthened, especially at the grassroots level.
We have done so much in the health area because health is wealth. Without health, you cannot do anything, and therefore it is number one. And that's why it took a number one position in my priorities. The primary healthcare is a very fundamental area in the healthcare delivery because they are the first point of call in all the villages. Most villages will not have access to a general hospital, but they will have access to a primary healthcare. As we speak, we have about 720 of them, and this administration has revamped about 500 of those primary care centers, and we give them our own improvised tricycle ambulance, which is unique with all the medical equipment you find in an ambulance, and that has helped healthcare delivery in those areas. Apart from registering the primary healthcare agency and getting Anambra State House of Assembly to pass it into law, we have revamped those agencies and what they are doing now. They are very well recognized in Nigeria today, and we have done so many things to reach the hinterlands. Recall that we bought 28 speedboats to be able to reach the hinterlands and 8 water ambulances.
Facilities were put in place, thus bringing about a more coordinated healthcare delivery system in the state, from the primary to the tertiary level. The Anambra State Health Insurance Scheme was one of such measures which saw the Obiano administration setting aside 200 million naira for the commencement of the scheme.
There's no way you can talk about healthcare delivery in Anambra State without our Anambra State Health Insurance Scheme. This scheme is a miracle. With just 1,000 a month, 12,000 a year, you will enroll. If you enroll in ASHA, you are given a card. With that card, you go to the accredited hospitals. All the missions hospitals are there, and other general hospitals are there. So with that, you will be able to visit any hospital that is close to you and be treated.
The Health Insurance Agency was established through Anambra State Health Insurance Scheme Law 2016 with a mandate of giving every citizen in the state access to quality health care at reduced costs. It is a mandatory scheme which implies that everyone who lives and works in the state should embrace it.
The mandate of this scheme is to ensure that every resident of Anambra State has mandatory health insurance that will entitle them to prescribed minimum benefit package of health care, which is of good quality, affordable, accessible, and equitably distributed, such that the man who lives here in Oka would have access to similar level of health care as a man who is far away in Nzam. The person who is far in Amoka should get the same level of services those of us who reside in Oka, Onitsha, Nnewi, Ekulobia would have access to. Now, this is very essential because we realize that the health indices in Anambra, just like what is obtainable before now, of course, in other parts of the country, was really abysmal, where you have people dying very early from preventable ailments, and sometimes not because they do not know that they need to go to hospitals in good time. Some people are actually aware, but they are limited by financial implications. When you move around town, we saw people, His Excellency saw people at that time who would carry pictures, very dehumanizing things. Somebody will expose very sensitive body parts, like a woman exposing the breast because there's a lesion there that needs to be attended to. Now, on no account should somebody do such a thing, but then people dehumanize themselves, begin to beg for procedures that could be conducted for as little as 40,000 naira, 20,000 naira. People would deliver in hospitals and they are not able to pay. So, with all the travels of His Excellency and all the exposure, he said, look, I have to get it right in Anambra State. We must get to a point where people will feel confident to walk into healthcare facilities, they have their healthcare needs met, and they walk out paying little or nothing. So that gave rise to the thinking, let us set up a scheme that will be run by Anambra for Anambra.
The process of enrollment into the scheme is not cumbersome.
To enroll into Anambra State Health Insurance Scheme, you have several options. Either you come to our office here in Oka to enroll, or you go to any of our offices outside Oka. We have an office in General Hospital Onitsha, at General Hospital Ekulobia. We have at St. Felix Hospital Nnewi, at Immaculate Heart Hospital in Aguleri, at General Hospital Umweri, and then we have at Our Lady of Lourdes, Ihiala. However, if you're not in any of those places, the easiest thing to do is to either go on our website at www.ashia, that is ashia.an.gov.ng. If you get on that website, on the web portal, you can pay for your health insurance directly, and Ashia will send you a reference code, and you take that reference code to any of our registration centers, which you will see on the website, and you go there, you are registered, and the Ashia enrollment card is given to you. The other thing you can do is when you get to any of those our offices, you can pay using POS from your ATM card, and then Ashia gets the money, the registration code is given, and you are enrolled into the scheme. But if you are anywhere and you want to enroll into the scheme and you don't know what to do, just ring us on our phone, 0802 181 0222. So if you call us on that line, the person who will receive will guide you appropriately where to go.
An enrollee pays a premium of 12,000 naira per annum, translating to 1,000 naira a month, while the civil servants have it deducted from their salaries. Within the package that Ashia provides, an enrollee needs to pay only 10% of the cost of medication after treatment.
Our vision, the vision of His Excellency which we are running with, is to get to that point where every resident of Anambra State will have health insurance, so that we don't have to go and sell our lands to pay for hospital bills. I don't have to go and tell somebody I am sick, I have XYZ condition, and then begin to seek sympathy for you to lend me money and what have you. You are sick, you pick up your Ashia card, you get into hospitals, you are attended to, they push the bills to Ashia, and you pay 10% of the cost of medication. It can't be anything better than this healthcare delivery.
The Anambra Health Insurance Agency introduced a novel approach to the scheme, which it termed the adoption model, the first of its kind indeed in Nigeria. The approach has enabled more indigent people to have access to quality health care. Wealthy Anambra people have been embracing the scheme. For instance, on Saturday, January 26, 2020, Daniel Chukwudozie, chairman of both Dozie Oil and Dozie Foundation, enrolled 1,000 lives in his hometown of Okija in Ihiala local government area, amounting to 12 million naira. At the ceremony attended by the Anambra State Deputy Governor, Dr. Nkemo Okeke, and the Secretary to the State Government, Professor Solochukwu Lobelo, and other top government functionaries, The Dozie Foundation chairman, so impressed with the support of the state government for his gesture to his own community, decided to enroll an additional 500 lives, which increased his original sponsorship of 12 million naira to 18 million naira. A number of successful Okija natives at the ceremony, including Paul Irine, a foremost philanthropist, quickly enrolled hundreds of more lives in the Okija community, bringing the total number enrolled in one day in Okija to 1,350. Officials of the Obiano administration had demonstrated leadership by example by enrolling indigent members of their various communities into the scheme. The Commissioner for Lands, Mr. Bonaventure Enemali, was one of the first top government officials to do so. Members of the Anambra State House of Assembly equally endorsed the scheme by enrolling hundreds of members of their different communities into ASHA.
Anambra State Health Insurance Scheme started that, and some other states are now beginning to see how they can do that also to increase coverage from the informal sector. For our adoption model, we know that in Anambra, 12,000 might not mean anything to several people. However, there are still people who 12,000 naira mean a lot to. So what we do is we go for advocacy to traditional rulers, to religious leaders, priests, reverends, and what have you. And then community gatekeepers, people who have influence in various communities. We sit with them to talk about ASHA and encourage them to please speak to their children who are philanthropists. Because in Anambra, you have philanthropists who could come during Christmas, for example, and give bags of rice to say 1,000 people in a community. Why can we not channel that kind of charity towards buying health insurance for people? After these rich philanthropic individuals pay this, give them these bags of rice, give wrappers, sometimes they even organize medical outreaches for 3 days to 5 days to take care of the healthcare needs of our people. They do this genuinely because they want to give back to the society. But that's where ASHA comes in. ASHA gives you a cheaper option to take care of the healthcare of your people. When you want to organize, say, medical outreach, these well-to-do in the Anambra spend nothing less than 5 to 10 million naira to do that. Now, if you want to insure people at 12,000 naira per annum per person, with 12 million naira, for example, you pay for 1,000 people into the health insurance scheme for 1 full year. With 6 million naira, you pay for 500 people. With 1.2 million naira, you pay for 100 people. Imagine what 1.2 million naira will do in the lives of 100 people who will now go to hospital, whether they need surgeries, because our scheme will cover you for both medical needs, for surgical needs. A woman who needs cesarean section, for example, our scheme covers it. A person who has need for appendectomy, that's when you have appendix, our scheme will cover it 100%. When you have hernia, and we need to do heniography, that's when people say hernia, but it's hernia. When you have hernia, our scheme does heniography, and it's covered 100%. When you have myomectomy to do, we cover it with a co-payment of 50-50. Now, all of these things are benefits you would have given to that individual because you pay 12,000 naira for that person. How much is a bag of rice you would rather give to that person? The person eats it, and the day illness will come, illness will eat up the bag of rice you have given to that person. Why not channel these resources to giving the person health insurance?
The Anambra State government, under the leadership of Governor Willie Obiano, as a unique way of marking the 50th anniversary of the end of the Nigerian Civil War, directed that all Civil War veterans be provided with free medical services in the state through ASHA. Governor Obiano emphasized that even the token amount paid at the hospitals by the enrollees for cost of medication be written off by the state government. All that the war veterans needed to do was to register with ASHA. These veterans need not be natives of Anambra State, but will benefit from the scheme as long as they reside in the state. Governor Obiano also directed that all members of the Rangers International Football Club of Enugu who played in the 1970s and early 1980s be included among those to benefit from the scheme at the expense of the state government. The governor said the move was in recognition of the preeminent role they played in lifting up the spirit of Igbo people at the end of the Civil War. Asia has hundreds of accredited hospitals, both private and public, in all the 21 local government areas of the state. With the availability of latest equipment in these facilities, the enrollees are assured of quality services which include highly and well-equipped theater units, laboratories, radiology units, dental and eye units, intensive care units, special care baby units, and physiotherapy units, amongst others. The chief medical officers and the managers of these facilities say the number of enrollees has increased tremendously over the last few months.
I will recall that we started from zero. By zero, I mean there was a time when there was nothing like Asia. But now we have more than 5,900 patients who are coming to our hospital. And this is happening within an interval of 1 year. Very likely, before the end of the year, we are going to cross that number. So if I'm asked to say, I would say that it is a tremendous improvement.
In fact, the number of enrollees in this scheme have been much. So kudos to the governor of this state, Governor Willie. He has done wonderful thing in making sure that adequate health care services is being provided to the masses in this state. Now, ENO Mission Hospital is one of the faith-based hospitals which has many enrollees. I think it is second in the state right now in the number of enrollees they have in Asia. So they've been performing wonderfully well in making sure that the masses are being treated.
When they started enrolling, we were with 1,000 lives. I think they said the greatest number of people wanted to be attached to mission hospitals. I said, okay. It's when you're satisfied with the service, you continue. If you're not satisfied, you request for. Now we are the highest in Anambra State. General Hospital Onitsha has the highest number of enrollees. And what does that translate to? We have more funds to run the hospital.
In this particular health facility, enrollees walk out of the hospital after medical treatment without paying a kobo.
At the onset of this program, after looking at the program, I decided that my own contribution as part of charity will be to donate back the 10% that enrollees are supposed to pay back to the enrollees. That will be my contribution to ensure that when people get sick, they don't have anything deterring them from coming quickly to see the doctor. They've had some beautiful experiences here. Take, for instance, last 2 months, we had 3 cesarean sections for Asia enrollees. And it's our policy that if an Asia patient enters that central door, we ensure you pay nothing until the day you leave that door. So, whereas somebody would have paid, out of pocket, would have paid 180,000 naira, which is our surgical fee for cesarean section. As an Asia patient, you pay nothing, 0. You get all the treatments, get everything, get the surgery done and everything. There was one day a baby boy was brought here at night, 12 in the night. He had obstructed hernia. He was in pain. A boy of about 3 years. So the doctor had assessed him and called me, said, we have the obstructed hernia for emergency hernia. I said, okay, tell them 250,000. If they have the money, I'll come and do the surgery. He dropped the phone. Then he talked to them. The father now said, okay, hey, I'm Asia. He now brought his card. After they told him the bill, he said, I'm Asia. So they now called me back and said, hey, the guy is under Asia. I said, oh, okay. I drove down, did the surgery. Instead of 250,000 we were talking about, he paid 0. Nothing. In fact, Asia officials later came to see the baby in the hospital. Fine, no bill, nothing. The 10% was donated back to them.
Asia engages in routine monitoring of accredited health facilities to ensure that they maintain the standards.
We do a lot of monitoring. We even have pseudo patients, okay, fake patients. We can just send somebody to go and say, this is an ASHA enrollee, go in and go under seek care. I have disguised myself to a hospital in this state. I went with my ASHA card to tell them I needed to see the doctor. On a Sunday, I did that, you know, out of doing our monitoring. And then I saw how they attended to me, so nobody would tell me. My monitoring team were all ASHA enrollees here, because the way it works is you choose a hospital by yourself. This is my primary provider. But in cases of emergency, once you carry our card, imagine you chose a hospital in Oka and you are in Mmiata Anam and you are sick. Why can't you go to Rex Universorium, which is implementing ASHA? Or you are in Aguleri, why can't you go to Immaculate Heart? Or you find yourself in Onitsha, why can't you go to St. Charles Borromeo, or to Iyenu, or to General Hospital Onitsha, or to Waterside? So all these are our hospitals. So what we did is, in emergency conditions, when you see an ASHA enrollee, he gives you his card. Whether you are not his primary provider, your primary provider or not, you render services to him and reach out to ASHA to inform us that we had an emergency, your enrollee came, we did XYZ, and ASHA will pay you. At the end of the day, we reimburse such. So using that mechanism, we usually send out our staff to go out to various hospitals on claim of emergency to see the response time. And regularly we pay spot checks. I will tell you clearly that sitting in this office, we have, with the support of His Excellency, delisted 3 hospitals from our scheme. We didn't care. We got there, they failed our tests. They didn't meet up to the standards. When we went for accreditation, because we accredit you before you come on board, we accredited them. They seemed to be doing well at the time. But when we go for our monitorings and find any issue, or people call us to complain, and we storm the place for inspection, and we realize that those complaints we got are true, we delist.
Though the scheme does not finance all forms of health procedures, it takes care of 65 to 70% health care needs of beneficiaries.
I can assure you that our benefit package captures at least 70% of the basic needs, or health needs, of a typical Nigerian. And your guess can be as good as mine, not just your guess being as good as mine. The World Health Organization says that anybody who has access to benefit package that encompasses primary services, you have 90% of the chance to live your life to the full potential. So if you are expected from the day you were born to live, say, up to 80, 85 years, when you have access in a health insurance, for example, of the kind of benefit package that we have in ASHA, and you use it judiciously, the tendencies that you are going to live fully is 90% assured. So doing that says clearly that we are on course.
ASHA has also assigned roles to other areas of healthcare delivery, thus involving every player in the health sector.
Medications are to be provided. The attending physician will fill out a prescription sheet, and you go to any of the ASHA accredited community pharmacies in town as it's convenient for you. You get to those places and you pick up your medications. Somebody who is hypertensive or diabetic, for example, who needs to refill their medication, you go there regularly. The doctor gives you the prescription, fills it out. You go to the pharmacy and take your refill. They send us the claims eventually at the end of the month, and we pay. Ditto for the optometrist. When you have issues with your eyes and there is need for you to go see the eye doctor, the attending physician will refer you appropriately. You go to those optometrists. So what we envision is such a time when, using the health insurance scheme, every player in the health sector in Anambra State will be doing their roles. Nobody will lord it over the other. I'm a medical doctor, and I know that some of these little things are the reasons why there are some agitations within acrimony within the health sector, human resource. So we need to address this fundamentally. Let the pharmacists do their work. Let the optometrists do their work. Let the lab scientists do their work. And then let the doctor, who coordinates as the leader of the team, do his own job and assign rules as appropriate.
ASHA enrollees say the program is a welcome development and applauded the visionary leadership of Governor Willie Obiano for introducing the scheme in the state.
I'm very excited for not paying because it's not easy to go in a hospital and after delivering you not pay a big amount that you're supposed to pay, especially for going through CS without paying anything. I'm very, very glad and very happy for the government that make it possible for those people who cannot afford the money and make it possible that if you are in ASHA, you can get a lot of things in it. So I'm very glad for making me to be one part of that.
Okay, for example, I came for test. I myself, I did typhoid test. It was free. Then my daughter was treated malaria. We just paid 10% of the drugs. Then my second daughter that was supposed to be undergoing surgery, the doctor told me that ASHA has paid for everything, just that the drugs, 10% of the drugs, what I'm going to pay. But the surgery, I'm not paying for anything. It's fantastic. It's really marvelous. I'm very happy because if I should have go to other hospitals, I know how much I will pay for that surgery. But the government is taking over everything. I'm so much happy.
At first, people were telling me I shouldn't bother doing it. That is of no use. At first, that you end up paying high, and even when you come with ASHA, whatever, that the doctors don't attend to them well. But when I came, it was the other way around. Everything was fine. I don't know if it's this hospital actually, but they attend to us wonderfully. At the end of the day, you pay a little money, very little that. This is not what I pay when I go to the hospitals. But it's so funny coming to the hospital and be paying 30 naira, 100 naira. After seeing a doctor and giving you drugs, you pay 30 naira. It was so funny. And at the end of the day, after everything, your child will be well. So far so good. I would say it has been wonderful.
They noted some challenges they encounter in accessing health care.
Well, my experience is okay. The only thing was, last week I came here. So we wasted a lot of time because I work at Onitsha, not local government. So the doctor didn't come in time until that 12:30 and we were worried about it. Even I intended calling Oka, but they didn't pick and the network didn't go. So, but when the doctor eventually came, he attended to us and the drug they gave me was okay. I got relief. But when I came back this week was, they didn't do the lab test. They said the specimen they're supposed to use, they didn't get it. So they said I should come back later. So I decided to come back today. So, but they have attended to me and the doctor has prescribed a drug. Today we didn't waste much time. But the pharmacy unit, they waste a lot of time there in collecting the drug. So they need more hands so that the patients will not spend much time.
The government on its part has put up measures to address these challenges, which borders more on manpower availability.
What I intend to do with insurance is that in a building where they are giving, their own mini lab will be there, the doctors will be there, their nurses will be there. With the doctor, you see the triaging doctor. Once the doctor sees you and the patient needs another subspecialty, somebody there, the desk officer will appoint one of the staff and the patient is taken there. So when they come to General Hospital, they see that in one spot, they get all services. It's not like a patient comes there, you see the patient, okay, this person needs a surgeon. Then you refer the person to ELTA. The surgeon is already with us. So a lot of people asked for, and I was just telling them this morning, we need to reduce the time the patients are waiting to be seen. That even if it means engaging more hands there. I also went to see the director of National Youth Service Corps, requesting for some purpose to come in. So that I don't want a patient to come in and stay for more than 10-20 minutes without a doctor attending to him or her. It's not acceptable anyway.
Governor Willie Obiano has made access to quality and affordable health care possible for over 81,000 people of Anambra State, even as the number grows by the day, with 268 leading hospitals participating in the scheme. Thus, saying goodbye to spending hard-earned resources on exorbitant hospital bills. Observers say this health insurance scheme will remain one of the great legacies of the Governor Willie Obiano administration.
With all our hearts, we pray and ask, God bless Anambra, God bless the shining light that we bear. We're the only ones to make her brighter, the only ones to make her better, the only ones to make Anambra shine. With our sweat and blood,